Okay, great. I think it's time for us to get started. My name is Sarah Murray, and I work for Mercy Corps as our Electronic Cash Transfer Program Manager. And right now I am leading the ELAN, the Electronic Cash Transfer Learning Action Network. And our Cash Transfer Learning Action Network has an advisory group that includes CALP and the IRC, Oxfam, MasterCard, the Norwegian Refugee Council, and Mercy Corps. And this network is all about getting better at using technology and partnering with the private sector to improve the quality of cash programming. And we are all about facilitating learning and sharing around what new developments are happening in the field. And that's why we are going to be talking about the Red Cross's experiences in the Americas today. So the ELAN, just for a little bit of background, we have 4 work streams or working groups that are focused on improving the quality of e-vouchers and e-cash, looking at linkages to financial inclusion, and issues around data management and security, all related to cash transfer programming. And we also facilitate technical support to a lot of agencies and the sharing of information. So I'll provide some links at the end of the presentation about how you can get involved if you'd like to. And our network is made possible with support from the MasterCard Center for Inclusive Growth. I'm really excited that Wendy Brightman and Scott DiPretoro are joining us to talk about their experiences with the American Red Cross, with the Red Cross movement's system in the Americas. Wendy is working for the American Red Cross as a regional cash transfer programming response advisor for Asia, the Middle East, and Europe. And in that role, she provides technical guidance to Red Cross, Red Crescent national societies in beginning or improving their cash transfer programming in emergencies. She's regularly deployed to the field, and she's headed to Nepal very shortly. She also provides remote technical support. Scott is a disaster management delegate with IFRC Pan American Disaster Response Unit with a technical focus on cash-based programming and livelihoods. He has deployed throughout the Americas to assess, design, implement, and evaluate cash transfer programs, and has experience working as a micro-enterprise coordinator for the IRC, as well as within the financial services industry. So we are really excited to hear from you guys. We will have about 20 minutes for each of them, so 40-minute presentation total, and then time for question and answer at the end. Please feel free to type in questions to the chat box. We'll be monitoring those. And yeah, so I'm going to hand it over to Wendy and Scott.
Thank you, Sarah. This is Wendy Brightman, and I'll be giving you a brief overview of our cash e-transfers in the Americas. So in November of 2012, the IFRC, with support from the American Red Cross, submitted a proposal to NetHope for an innovation grant. This was supported by the Visa Foundation. The project sought to use electronic payment methods to provide cash assistance to disaster-affected populations immediately following disaster throughout Central and South America and the Caribbean. So the product we're going to talk about today is actually a stored value or a prepaid card. It's not a specific part of a project or a program. Rather, it's a contract that we have in place for disaster response within Latin America and Caribbean region. This includes 35 countries. So the contract is only used when it's requested from the company. The card is able to be shipped to the disaster location that we identify. It's able to be loaded from a remote off-site location if it's desired, with a specific amount of funds for the beneficiary. The card is distributed to the beneficiaries and then activated for use once the beneficiary receives the card. They can use the card at any Visa logo point of sale or swipe machine, an ATM, or online. The card expires within about 1 year after printing and the funds are no longer available. So just wanted to give you a quick overview of the tool that we're going to be discussing today. We were asked to share some of the lessons learned over our experience and how did we get to the point of actually having a contract. How did we negotiate? What were some of the key learnings that we had during the process? So I was part of that process, and then in the second half of the presentation, Scott will go through how does the actual card work and what were some of the results of the pilot that we conducted this past year. So let's look at the way that we started with the contract and the researching that led us. All right. So for the first step, we set the mechanism requirements. We needed to determine what we wanted and what we needed. And any of you who have done procurement for a similar process are aware that there are lots of things that you want in a program or in a platform, but it's not necessarily everything that you need. We pulled together, so to make this decision, we brought together our finance director, disaster management officers, our program side, our logistics and procurement department, and technical persons for the discussion. We spent several hours identifying the problem that we faced in providing cash to beneficiaries in emergency settings. We then created a perfect world scenario to identify what types of activities we wanted the payment mechanism to do. For example, we wanted to have flexible payouts. We wanted to be able to have an electronic system that was able to be used at ATMs, at point of sales, able to be online used, but not only for credit or to buy things electronically, but we wanted to have cash in hand. We wanted to have the ability to have our brand visible or not. We wanted the ability to track payments from our bank account to the beneficiary. We wanted minimum know your customer requirements, etc. We outlined these in a list, and after reviewing our list several times, we solicited feedback. We began our weighting exercise, and that's to say that we decided what requirements were critical and what requirements were nice to have or preferred. So the lesson learned from this particular exercise was that it was critical for us to have a multidisciplinary team for this phase, as each was responsible to review for the specific controls to prevent misuse of the mechanism. At the end of the discussion, we had a list of requirements that we felt comfortable to begin discussions with various financial service providers. A concurrent step was to identify a payment mechanism that we felt comfortable using and that met our requirements. So this leads us to the choosing of a delivery mechanism. First of all, we had a technical support person, which was me, assigned to researching each of the 35 countries that we wanted to cover with this particular delivery mechanism. I generously refer this to as a mapping exercise of the electronic delivery mechanisms available in the 35 countries, and you can see those on the right side on the map. We included bank account transfers, prepaid cards, gift cards, mobile money, and remittance or money transfer operators. All were included in the study. My task was to review each country, see if one or all of these mechanisms were present. If so, we then wanted to see what the preference or prevalence of the use of the mechanism among the population. What was the penetration of the service throughout the countries? Once this was done, we began to see clear trends of delivery mechanisms, and providers began to emerge from the data. So in this step, we learned that it took significant time for the activity. It took a few dedicated months of research to figure out the level of preference as well as coverage for each of the different mechanisms.
Hi, Wendy, this is Sarah, and
yes.
I'm sorry to interrupt you, but I see a little bit of audio trouble in the chat window, and I wanted to check in with the group to see who is able to hear what Wendy is saying and what I am saying. So if you are able to hear us, can you please give us a little smiley face or say something in the chat box quickly? Great. Okay, so it seems like a lot of people are able to hear us, which is fantastic. There are two things that you might want to consider if you aren't able to hear us, which I guess I'll have to put in the chat box because people can't hear me. But excuse the interruption, Wendy, and please go ahead.
Sure. So looking at, just to recap, we were choosing a delivery mechanism. We were looking at the prevalence of the mechanisms, how they were used in the population, and we began to see clear trends of which mechanisms were actually being used throughout the Latin America region. So the lesson learned here was really to schedule significant time for the activity because it takes, it's not a quick or easy project. When we started. Now, keep in mind that we were doing this research in 2012, 2013, and now, in the last 2 to 3 years, we've seen a lot more companies and initiatives pulling together this electronic payment mechanism research, and it's becoming easier to find that information. So our next step was how to actually research the providers. So we began researching the financial service providers that had the services that we saw from our research. The prominent mechanism that we were seeing was a prepaid card that could meet our requirements. It seemed to have a number of possible products and a lot of providers available in our initial scan of the industry. So we found this out by reviewing the providers based on their locations, on their network, and their reach. We were looking to cover as many of our target countries as possible. Remember, we had 35 target countries that we wanted this mechanism to be used in. We wanted to know, did they offer a product that met with our requirements? We reviewed the providers based on the currency conversion abilities. Could we deposit into a USD account? Could we have the money be exchanged and then available in the local currency for the beneficiary to withdraw? We reviewed governing laws, regulations, and requirements of the providers to see what restrictions they had to work within. We then researched their history of any fraud cases, fines, penalties, cases of anti-terrorism or money laundering events, and their rates of liquidity. Most of this research I would consider due diligence or kind of a background check on the financial service provider. Remember again in 2012, 2013, one of the lessons learned in this part is I had quite a lot of difficulty finding due diligence checklists or suggestions or tools to use to conduct this with financial service providers. I asked our finance department to give me recommendations on how they chose their banking institutions and how did they stated they did this kind of ad hoc, similar to what I was doing. It was quite frustrating early on not to have a clearly defined list of questions with good data points that would be an indicator whether this was a good partner. During that exercise, I began to collect these data points and compile a checklist. So now, 2 years later, many of you, if you're going through this activity, will find a great guide put out by NetHope, sponsored by USAID, which discusses many of the questions that you can ask the provider. So we do have resources that have been developed lately that really do help this research. So our next step was to look at the actual providers that we found. So we had a list of approximately 3 to 4 banks that seemed to have connections, branches, and possibly card products that would fit our needs. After trying to contact several of these, only 2 returned our requests for information and discussion. We're a very large international organization and we have a well-known brand. However, we did not offer them a big enough customer base to gain their attention. We had interviews with both banks, and in the course of discussions, we found only one actually had a product that would meet our needs. In further discussions with that bank, we found it only covered 5 of the 35 countries we wanted. So this effectively stopped our conversation as it looked like the project would not be possible to cover all 35. So the lessons learned here, we relied heavily on our thinking that banks were the only provider or possible partner. We realized that the banking sector, of course, is the natural one to think of. However, it was obvious they could not provide a solution for our need. So we needed to look outside of our typical banking sector for the answer. This put us into new territory. Previously, we'd always worked with a bank partner. We started to research global payment solution companies. We talked with our connections at NetHope and Visa and found that there were third-party providers who could possibly meet our criteria. This was a key lesson learned for us, that simply because a mechanism has the capability of providing cash doesn't necessarily mean it's a financial service, or it doesn't necessarily mean it's a bank. And you don't necessarily have to go to a bank to get the service that you want or the product. So this led us to our next point, which is good partnerships. And so we began our conversations with a third-party vendor, and we quickly found a difference in the way that they spoke to us. The banks were happy to share information, and they were very interested in being a part of what we were doing. It was clear, though, that they had specific know your customer requirements and that they worked in specific regulations that they could not change or cross. We were not asking to do illegal things, and we didn't want to have but we did want to have our requirements met. It was soon clear that the bank wanted to sell us a product. They wanted to enlarge their customer base, but they didn't necessarily have the ability to modify the product to meet our need or customize it. We found in our discussions with a third-party vendor that they wanted to sell us their product, yet their business model included a highly customizable product for their customer base. So they were used to changing to meet the need of the customer. And it was not unusual for them to create new or different products or modify their system to meet our need. So this is a key difference between the two entities that we had the discussions. We found the customization flexibility was exactly what we needed for the project. We also found that goodwill and desire to work on meeting our needs, and that was a refreshing change in the partnership. So the lesson learned here was that in looking for partnerships, look for partnerships that provide you with opportunities and also opportunities for your vendor. This creates a win-win situation for both of you. A good partnership would include reasonable rates, negotiated percentages, flexible services, the willingness of the partner to review their systems and ask for feedback on how they can improve their platform for your ease of use. We also found a willingness and a budget, the willingness and a budget invested in making the program a success. So we think we found a vendor who has provided us a good partnership rather than just a contractual agreement. And that's a very important part and a valuable commodity in our world. So looking at these 5 top lessons learned, it was very brief. I understand it was very quick. But we also have a lot more to say on actually how the card worked and our experience as we've used it in the field. So I'll turn it over to my colleague Scott at this time to walk you through how it actually works.
Thank you, Wendy. This is Sarah here for 1 second before Scott jumps in. I really appreciate you sharing all those lessons. Fascinating for us here on the line. And I wanted to take 1 second to check in on the sound and make sure people are still able to hear well. If you could send me a quick note in the chat box, that would be great. Thank you, guys. Excellent. And okay, so we are still able to accept questions as you're coming up with them in the chat box, and we will get back to Q&A after Scott completes this section of the presentation.
Okay, thank you, Sarah, and thank you, Wendy, as well. And good morning or good evening to everyone on the line. Thanks for calling in. And for the next part of the presentation, I'll be providing an overview of the system and how it's actually managed, and then discuss how we paired it up with an electronic beneficiary registration and distribution system during the pilot in Jamaica, and then provide some additional information on the pilots that we conducted and what were the key learning points for the use of this regional prepaid Visa card system. And then after that, as Sarah mentioned, then we'll open it up to your questions. So it's been approximately 2 years from the conception of the idea to actually having the system in place. It's the first time that the IFRC has developed and contracted for a regional CTP delivery mechanism. And so we had to clear several stages, working through finance, legal risk, logistics, to make sure that everything was in accordance with our regulations. The system has been active since November. After we got the contract in place, it took a few months to work with the provider, Swift Prepaid Solutions, to get the approvals from the issuing banks, from Visa, to design the card, and to train our staff. We have a service contract with Swift, and they're the ones that manage the relationship with the card processor, the issuing bank, the card fulfillment house, which is the organization that prints and ships the cards, and with Visa or MasterCard. It is a single load prepaid Visa card for disaster relief assistance. However, we do have the ability to set up different sub-programs with Swift if we want to have reloadable cards or cards with a longer expiration date. It is an open loop system, so we are able to, the beneficiaries, households can use the cards at a point of sale or ATM, so it'd be unconditional cash, which is the intention of the card system. But we also do have the option with Swift to make their use conditional, to have a restricted spend, to restrict it to certain merchants based on their unique ID codes with Visa, or merchant categories such as supermarkets or building supply stores. There is beneficiary security against fraud and theft. We do control the system, and so we can distribute the cards and then activate them that night or the following day, so that people are able to return to a safe location. The beneficiaries are able to obtain their balance and transaction information via calling into the local Red Cross through a local access number, and there is also a website that we can access, or that they can access. With this program, we have the ability to pre-position cards, and we actually have put in place 1,000 cards in stock here in our Panama office for rapid deployment. Or we can do a per event inventory management, because the orders, after we place them, they can be processed and shipped within 3 business days. And in the case of Jamaica, they arrived 7 days after we placed the order at the Red Cross office. The order management system, the OMSI, that is Swift's proprietary software platform that they provide, that allows us to have full control of the prepaid card system, from ordering the cards, funding them, activating and tracking the cards, to controlling user permissions, and also viewing history and generating real-time reports to monitor the status and security of the program. We can view our card inventory online, and we can choose and activate cards either individually or by doing a bulk load and activation. Using the system to fund and activate the cards, it's relatively simple. We can download an order template from Swift, which contains all of the relevant card information. And then we just attach the names, the individuals to the cards, assign them. Then we upload the template back into the system, and within a few minutes, we can receive a confirmation of a successful fund. There's an inventory management feature, which allows us to create multiple programs, have different products, whether it's a loadable, reloadable card or single load card, and also specify the different locations for shipping purposes. We're also able to transfer card stock between different programs. So if we ordered an extra 500 cards for one country and that were not used, we could put them back into our general inventory. Also, for each program, the system shows us the virtual bank balance that we've transferred to Swift for that program, so that we can see what level of funds is available for us to activate cards. Through the view history function, as well as a separate customer service application, we can perform multiple functions related to card account support. So we can look at in detail at the transactions, and the card status. It also allows us to deactivate cards and to reissue new cards if a card was lost or stolen, so we can prevent fraudulent transactions. As far as customization, besides the inventory management feature, as you can see in the lower right-hand corner on the slide, we have our logo on the card. We're also able to customize the third and fourth line embossing to reflect either a beneficiary name or a specific program. There we have Jamaica Red Cross Humanitarian Aid. There's also a trifold carrier that comes with the card, listing the information on how to use the card at an ATM or point of sale terminal, as well as the fees. And we have that printed in 2 languages, Spanish and English, so we can have a standardized stock for Latin America and the Caribbean. We've also been able to work with the provider to have our IFRC budget codes reflected within the system, so we're able to track cards by operation, and that helps facilitate the reconciliation at the end of a program. Also within the system, as far as controls, segregation of duties, we can control user functional permissions, and the order amount maximums that a certain person can load onto a cards by day or by the week. We've also been able to separate out the fund and activate function so that our field delegates can fund the cards. They can attach a customer name to a specific card, but the activation is done here in the Panama office by a few designated users. We're also able to, by controlling the functional permissions, we can restrict people by program. So for instance, the delegate in South America would not have access to the to a program in the Caribbean or Central America. How do we manage the system? We've developed SOPs for its management, which are inclusive of defined roles for the disaster management delegates, as well as for our finance personnel and logistics. We've also developed beneficiary communication SOPs and tools, and I've had some of those translated into Spanish for use throughout the region. The SOPs cover a wide range of functions for managing the systems, from ordering the cards, receiving the cards, storing and managing the cards, withdrawing the cards from inventory, transporting and shipping them, loading the cards, distributing the cards, activating the cards, monitoring, replacing lost stolen cards and PIN codes, suspending, restoring, deactivating cards, and reconciliation. So it's a very detailed process that we developed, so everyone's clear on their roles and responsibilities, so we have the proper controls in place to manage this type of program. So we've completed a total of 3 pilots. 2 of them have been internal in Panama and the US for staff or for participants in a cash transfer training to test out the internal procedures. And then we've done 1 field test in Jamaica. And all of these pilots have been small scale, 100 recipients or less. But besides developing and testing the eCash delivery mechanism, we've also been collaborating with our innovations unit and the University of Washington on developing and testing a beta version of the Open Data Kit 2.0, which is open source software that can be used for the electronic beneficiary registration and distribution, so we can have a more rapid and streamlined process so that we can get the cards out into the field quicker in a more accountable manner. So ODK basically, it allows us to create survey questions to ask and answer on a smartphone. We can define the forms and set the question types, and then as the questions are answered and the data is input on the separate smartphones, it is then stored into a cloud database. So for the Jamaica pilot, in the field, the Red Cross volunteers started by interacting with an ODK Tables app, which you can see in the photo on the left, CTP pilot. And there's 3 buttons there: registration, distribution, and beneficiary list. The registration button would open the ODK survey to collect the information we needed, basic information including name, address, etc. And then they would scan a barcoded registration ticket that would later be used for the distribution. So after they received the distribution ticket, then the beneficiaries were presented with an information session on how to use the card, what was the funding amount, how to obtain their balance information, and other program details, including information about a complaint and response mechanism. And then to supplement the verbal presentation, we also developed written materials, a frequently asked questions sheet, and an ATM tip sheet that were distributed. And while the information session was going on, we collected the beneficiary information from the different mobile devices into a single cloud database and put it into an Excel file. And then beneficiaries were then assigned a unique envelope code that corresponded to a particular prepaid card. So as you can see in the middle photo there, we have a barcode on the envelope, which would correspond with the barcoded registration ticket that they received. So when distributing the beneficiary cards, the volunteers would press the distribute button, and this would prompt them to scan the beneficiary registration card, and then after doing so, it would display the envelope code that the beneficiary should receive to ensure that they had the correct one. And then it would flag the envelope as distributed within the system. And with this Open Data Kit still in the beta version, but there's additional functionality that we could include, such as being able to take the beneficiary photo and having that show up on the screen when they are there to collect their assistance. And we could also have a signature space in which they could use a stylus so that we could record that they actually received the envelope. So once that was done, we exported the data. We had the envelope numbers, we had the beneficiary names, and then we would simply go into the Swift order management system. We would download the order template for the 100 cards that we had, the inventory that we had on file. We would paste in the beneficiary names, assigning them to the card that they had received, and then we would hit the fund activate function. Within 5 minutes of submitting the batch order, as you can see in the picture on the far right, we would receive an email notification, an e-report regarding the requested action, showing that the cards were funded and activated, how, by who, at what time, the name of the program, and the total number of cards, and that it was successful. So it's rather quick and easy to use, and to operate it in the field in a remote manner. So some of the pilots, they had the main objectives were to test the SOPs that we had developed, both for the use of the system and for beneficiary communications, and also to test the working relationship with the financial services provider with Swift. We also wanted to test out the pairing of the Open Data Kit 2.0 for the registration and distribution. Additionally, we want to test the acceptance and use of the card by the beneficiaries, but also with the national societies, the Red Cross national societies, who are the ones who are implementing the programs with Federation support. And then finally, we've been developing a case study and video to socialize the program and to advocate its use in the future for Federation operations, drafts, and emergency appeals. So some of the lessons learned, or the key learning points, were regarding beneficiary communications and training. We realized prior to conducting the pilot in Jamaica that this would be a priority, would be a critical point to cover to ensure the successful use of the cards. We did develop some additional ideas with the Jamaican Red Cross volunteers on how to improve this for future programs, such as standardizing the training if we were to do a large-scale program, to produce a training video on how to use an ATM, because there were some issues, particularly with elderly beneficiaries who had issues with using the cards. Potentially to have field level support by volunteers to assist with the use at the ATM during designated hours. Additionally, communications not only with the beneficiaries and with the Red Cross staff, but also socializing the program with the merchants and the local banks where the beneficiaries would potentially use the cards at an ATM or point of sale. So they would be aware that there will be people arriving with these cards. They might need assistance in using them in order to avoid any potential use issues. We also looked, we did set up a local call-in number, but if we were to have a larger scale program, we'd set up a local call center where beneficiaries could call in and we could provide their balance information and resolve any card issues. There is a public facing website that the beneficiaries can access, but we realized that obviously they're most likely not going to have internet access, so we could provide a phone number and conduct that research for them and resolve any issues. They would also be able to change their PIN if they wanted. So with that, extensive monitoring is needed at the distribution site to ensure receipt of the card, exit surveys to ensure that they know how to use the card, who to contact in case of any issues, setting up the feedback and complaint line. And then we also conducted post-distribution monitoring. We conducted a survey with approximately half of the beneficiaries to evaluate their opinions, to see if they had any security issues or problems with using the card, and if they were able to resolve their complaints or issues successfully with the Red Cross. Additionally, with cash programs and electronic ones, we have the ability to conduct transaction and balance monitoring. And with this, we're able to go in and find that 97% of the funds that we loaded onto the cards were used in the first 2 weeks after the distribution. As far as with the provider, there's we're unable to get an aggregate report on the transactions and balances of the individual cards. So it is a time-intensive process to go and pull single records. With the shipping and customs clearance, we need to work through the national societies to ensure that the cards are not delayed in customs. For the pilot in Jamaica, we shipped the cards in 3 manners. I carried in a Pelican case 100 cards. We ordered and shipped from the provider in the US 100 cards, and we shipped 100 from our logistics unit here in Panama. The one that we shipped from Panama was held in customs. We did have to pay a small duty. SWIFT has extensive global experience shipping these cards around the world. They've stated that they have received inquiries at times, but they have no major issues with clearing the cards. But once again, it'd be on a case-by-case basis. We need to conduct that analysis. The cards are issued in US dollars. We also have the options to issue them in euros or pounds or Canadian dollars. So with that, it's hard for the beneficiary to track their balance information accurately. When factoring in the fees on transactions for an ATM withdrawal or a point of sale transaction, which has a 2% fee for foreign currency, and then also to with the FX fluctuations and knowing what is the exact exchange rate that we are receiving. So that's something that we have to factor into our program to potentially top up the cards to account for that, to err on the side of the beneficiary, and provide additional information for the beneficiaries on how to obtain their balance, possibly by setting up a call center. The fees charged to the beneficiary, this was an issue with, I'd say about 10% of the cards that were, people had entered the wrong PIN. They tried to withdraw more funds than were available, or they were repeatedly checking their balance information at an ATM, which incurs a small fee. So we need to be very proactive with the communication on correct use of the card, so that they can avoid this and use them successfully. So there are costs for having a regional system that are higher than setting up one on a national basis when you factor in the ATM fees and the 2% point of sale. But the benefit is that we have one contract, one system that we can activate and use in 33 countries here in the Americas. So I feel that these far outweigh the cost. So the way forward is post-pilot. We are now finalizing the case study and video for socialization and advocacy amongst the national societies in the region. Post-pilot, we've also trained all of our disaster management delegates in the region on the use of the system and provided them with the findings from the pilot. And then now we're looking to utilize the system in any disaster response emergency operations that the Federation is supporting going forward. And based on what we have achieved here in the Americas, IFRC is now looking at developing other regional or global payment mechanisms. And what this means for us here in the Americas is that we're ready for CTP in a large-scale urban response with a systematic and institutionalized delivery mechanism. It's an additional rapid response tool to complement our other services and in-kind items that's available to national societies. And 90% plus of the program funds would be going to the beneficiaries in the local markets through a secure and accountable system. And then this is intended to build the national society capacity to implement cash programs on their own. And then the lessons learned and the tools that we've developed, the SOPs, the contracts, could then be used as a model for national societies to contract at the national level if they have the financial and technical capacity. So with that, I'll turn it back to Sarah to moderate the question and answer session.
Great, Scott. Thank you so much for that overview. Really fascinating, especially for those of us who are always struggling with setting up a new system in each new country we go to. So I'm going to start off and kick off the questions with one that is going to Wendy. Wendy, you mentioned that it was a big relief when you started talking to SWIFT and some other third-party service providers, and that it was a very different experience than talking to the banks, and you felt that it was more of a partnership. And I wonder if you could tell us a little bit more about that and what the difference in that relationship was with the third-party providers, and also who within the Red Cross is actually managing that relationship with SWIFT. And for the rest of the participants, just to let you know, we have 35 people in the room at the moment, and please feel free to add questions in the chat box, and we'll get to them as soon as we can.
All right. So the question is the difference between, or how the conversations differed between the bank and the third-party vendor. And I would say that the key differences were the banks they're large, they have very stringent laws that are governed by each country. They have their specific regulations, and they have a larger customer base to create products for. They're processing millions of payments, and so when we were approaching a bank and mentioning that we don't have a lot of massive disasters in the Latin America, Caribbean areas, we have a couple of thousand households at a time. And so when we looked at our contract, they said, how many cards do you think you would use in a year? And we said a couple thousand. A lot of them weren't interested in necessarily talking with us because we weren't providing them with a large customer base. So a lot of them wanted to help. They have their humanitarian, their community involvement side of their social interest. But again, we just didn't bring the level of business to them to make it profitable for them, and they're after the profit for it. I can't for the third party vendor. It's also, they do millions of payments, but they're used to small customers as well as large ones. So it was much easier to explain that we wanted a small, here's 3,000 cards or 5,000 cards per year. And they said, that's okay. We can actually work with that, and we do a scalable service. So that was the main difference, I would say, between the two. I have a second. Okay, go ahead.
Thanks, Wendy. And then could you tell us who within the Red Cross is managing that relationship?
Sure, and that's actually Scott holds the contract is through the zone with SWIFT. So the Red Cross does have a contract with SWIFT, and it is through the America Zone office, which is Scott. I believe you're the lead for that. You can answer better than I can.
Yeah, we have a 2-year service contract with SWIFT prepaid.
Okay, great. Scott, there's another question from James Shepard-Barron, who's asking and mentioning that Jordan, Japan, and Lebanon have all moved to biometrics instead of the chip and pin EMV cards. And he was wondering if the IFRC has looked into that system or that technology.
I would say that, we've looked into it. Our colleagues in Jordan have shared the information about the prepaid card program that they have there that uses the iris, the biometric technology. But here in Latin America, those are not prevalent, existing at the banks and the ATMs. So at this time, we're working with the PIN.
Thanks, Scott. Another question popping up in the chat box here from Patrick Eckford. He's wondering if you can give us an example of the total amount of fees charged to an average beneficiary for using their card.
Sure.
And that would be, yeah. Go ahead.
So for an ATM withdrawal, because it's an international card, there's a $4.95 US charge for international ATM use, in addition to any local bank fees. And then for point of sale transactions, it's 2% of the transaction value to account for the foreign currency transaction. And then if a beneficiary checks their balance at an ATM, it's a 75-cent US charge, as well as if they have an ATM decline due to insufficient funds, it's another 75-cent US charge. So that is why the beneficiary communications is so critical, encouraging the beneficiaries to only withdraw from the ATM one time, and then to use the balance at a point of sale terminal, or that they can maximize the value on the card by doing the full transaction at a point of sale.
Great, thank you, Scott. There is another question here about the movement of money. This is coming from Marco at UNHCR, and he's asking if one of you could please explain how the money moves from your Red Cross bank account to SWIFT, and then does SWIFT have a dedicated account in each country? But feel free to go over that process for us.
Sure, I can handle that. So we follow our Federation financial procedures, and we place a wire transfer to SWIFT to a sub account that they have set up for us. That money is then with SWIFT at their bank account. From there, we work with our account manager to move those funds to a certain program, for instance, the Jamaica pilot, or for the general inventory program. And then those funds are then reflected in our virtual bank account balance within the order management system by program. And then, so everything is held by the cards are issued by Bancorp Bank, which is one of the larger issuing banks of prepaid cards. And so we don't have to have any funds transfer outside the US or to separate countries. It's all managed, it's all centralized with one account with SWIFT in the US.
Great, thank you, Scott. I'm seeing another question here about the fees charged. This is coming from Paul, and he's asking, is there no charge for the withdrawal itself beyond the 2% currency fee? What about topping up for IFRC? Does that come at a cost?
There's the ATM withdrawal fee, and then there's the for point of sale transactions, it's 2%. There's no for the Red Cross cost. We pay for the plastic, so it's $1.50 per card. We also pay for the an activation fee of $1 per card.
And if you, as IFRC, add money to a beneficiary's account, do you pay an additional fee for that top-up, as it can be called?
Well, the program that we have is it's a one-time load, so we pay that $1 activation fee for every time that we load funds into a beneficiary account.
Got it. Okay, thank you. And I'm going to get some help fielding all these great questions from Bree. Once I unmute her.
Hey, can everyone hear me? I'm sorry, I just wanted to make sure if someone could just write tap a little happy face or yes in there.
We can hear you.
Super. This is a question from Michelle, and then I'm going to hand it over to Wendy. Could one of you elaborate upon the process of how the service provider SWIFT was identified and selected? And specifically, was there a public procurement process, or was it a negotiation partnership development directly with SWIFT?
I would say it was a combination of the two. We had discussions beforehand. We talked with various banks, with Visa, trying to identify potential partners. We were then referred to SWIFT. But then we also, after that, we did a public tender and sent out the requirements to several different banks as well as SWIFT. So it was done in combination. And SWIFT was the one that was able to meet our needs.
Great. There was another question from...
So one of the questions that...
Sorry, go ahead, Wendy.
So there is a question here also about the restrictions on the card from Jaegung. Is there any system to restrict the withdrawal from the money from the card, or any limitations? As Scott mentioned in his presentation earlier, there are merchant codes that exist for each vendor or for each merchant, and there is some ability for cards to be restricted according to vendors. We have not at this point in time restricted any vendors on the card because we are trying to have it as unconditional as possible after a disaster, but there is that functionality. There is not a limit of the amount of money that can be withdrawn at an ATM at this time, so they can withdraw the full amount from the ATM. So there's no limitations on the amount that can be withdrawn except the amount that's on the card. They can't withdraw more than what's placed on the card. Bree? Or Sarah?
Great. There was one question about the ethics of this program, and this question came from James Shepherd-Barron, and he was wondering if you had any considerations or concerns about connecting a largely unbanked population with a service provider or a bank, and essentially doing the marketing on behalf of a private company.
Well, the cards are just branded as Visa cards, which they can then take to any bank or any merchant that has a point of sale terminal affiliated with Visa. So we're not directing them to any particular financial service provider. There's no mention of SWIFT. And we're providing them with the information on how to use the card so that they can access the funds.
Super, Scott. Thanks so much Another question, do you anticipate any challenges to taking this from the Latin American Caribbean region to other regions or globally?
So I can respond to that one too. I've been with the Federation to look at possible global contracts. The contract itself is not the challenge. The difficulty or the challenge is whether or not the prepaid or stored value card is appropriate for that country. And each country has different regulations and laws that govern how a card is used. So there are these regulations that one has to research. Case in point, we were looking at potentially taking this contract and using it in Ukraine to work in the crisis there. And it took us several weeks of research and investigation of the Ukrainian law to see whether or not an external prepaid card would be useful in that context. So it's not necessarily that we anticipate challenges taking the contract itself globally and using the cards. It's more of we have to be sure that when we do our our delivery mechanism feasibility in that country before or during a disaster, we have to check that out before we can send it in. Now, SWIFT does have the ability to recommend to us which countries they already know they can work in and which countries they cannot. So we do have that list available to us. Do you have anything to add, Scott?
No, I think that sums it up. And I can answer the question about what happens if there's no banks or ATMs available. Well, this is just part of, it's an additional response tool, and then one that we would analyze its feasibility when conducting the initial assessments. And so if we were looking to do a cash program, then potentially we could do vouchers, in kind, or provide the other services. So it's just an additional tool that's available.
Excellent. Well, this takes us to the top of the hour, so I want to send a huge thank you to Scott and Wendy for first of all, finding an appropriate tool to do cash transfers at a regional level and for sharing their lessons learned with us. And I wanted to invite everyone, all 34 of you who have stayed to the very end, to stay connected to this conversation through the Electronic Cash Transfer Learning Action Network. There are some hyperlinks on this last slide that will allow you to sign up for our monthly updates and will allow you to participate in our 4 working groups, which are debating and working together on all of these types of questions. You can also get in touch with myself or Lily Fry, who both of us are working on this network and here to be your resources. So thank you very much, everyone, for joining us today, and to Scott and Wendy for an excellent presentation and discussion. And we look forward to more discussions of this kind over the next year and a half. We will also be sending out a recording of the presentation and the slides to everyone that RSVP'd for the webinar. So the recording will be available, and we can make the presentation available as well. So thank you very much, and enjoy the rest of the morning or evening wherever you are.